So a common question that I receive is, do donuts and lamb's wool protectors really help with pressure ulcers? I'm Bienstock. I'm a board certified plastic and reconstructive surgeon. My specialty is wound care, particularly those patients and loved ones that are homebound and bedbound. Today we're going to talk about donuts and lamb's wool heel protectors and other devices such as those. So a lot of times I come to see a patient and I'm consulted, and the patient has what's called a donut, meaning like this big circle with another circle, and they sit on this either in bed or on a chair, and they still have a pressure ulcer. And the families go, my loved one is sitting on this donut, but they still have a pressure ulcer. The donut doesn't really replace everything. The key thing is keeping pressure off. What the donut does is, yes, it can take some pressure off where the wound is, but it creates pressure and skin irritation elsewhere. So I had one patient who I saw 3 years ago. They were using the donut religiously despite my supplication, and they got pressure ulcers and wounds adjacent to the original wound. So anytime you have this type of device where you're sitting on it when you shouldn't be sitting at all, and you're sitting on a thick donut, even though the circle can kind of protect the original wound, the problem is it can create wounds elsewhere. The most important thing is to have your loved one either off of it at nighttime, meaning sleeping, use wedges, so they're sleeping on the side. I call this, I can kind of show it to you, the leg crossover like this, so there's no pressure on the butt, and if they're sitting too much, they get wounds right here, which I'll show you right here. You just have to minimize that. There's something called Rojo cushion that can mitigate that. But the most important thing is really just minimizing pressure. There's no specific device that you can lay on or sit on that removes all pressure. Also, you have to imagine that they're getting pressure ulcers and we're calling necrotic tissue in those areas, meaning the dead tissue, because the blood flow is being knocked off. It's not just from pressure where you're sitting or laying, it's also pressure below and above that, which can knock off the blood supply. If you knock off the blood supply, that means there's no blood, which means no oxygen getting to that wound, which can lead to deterioration and skin breakdown. Now, other patients I see also have something called lamb's wool, these heel protectors. They're basically like a lamb's wool coat that's made for the foot. These are very hot and warm. They don't allow any oxygen or air to get in. So you can imagine if it's 90 degrees in summertime and you're wearing this kind of lamb's wool glove on your foot, it traps a lot of heat, moisture, and sweat and can lead to skin breakdown. So I definitely say these are no-no. I like patients to be sock-free, as well as these type of boot-free, and keep the foot floating, as I talked about in pressure ulcer relief in feet, and let the feet breathe. Now, if that's not possible, the boots that I do like are called Prevalon heel protectors, or protectors are like that, meaning it's kind of a type of cushion, cotton material with a vinyl latex backing that has a hole where the heel will be placed. So it takes pressure off that. You can wash these materials; they're much more breathable. The bottom line is the most important thing is, as I talked about in other videos, pressure relief, turning, and offloading. None of these donuts or cushions are really great in removing all pressure. It's not that they don't serve any purpose. It doesn't get to the original thing. If your loved one, whether mother, sister, father, husband, wife, developed a pressure ulcer from laying or sitting, you have to make sure they're not laying or sitting on this. Replacing it with a special cushion or seat that has a hole in it is not going to eliminate all pressure. If you have any questions or comments, please leave them below. Make sure you subscribe, and please share the channel when you get a chance. Thank you.